WaterAid is the world's leading water, sanitation, and hygiene organization in the world. With a global reach, WaterAid partners with governments and local organizations to help families and institutions. WaterAid believes that everyone and everywhere should have access to safe water, sanitation, and hygiene by 2030. It is within this context that WaterAid decided to expand its program to Rwanda in 2010.
WaterAid has a vision of a world where everyone, everywhere has access to safe water, hygiene and sanitation. WaterAid has been first registered here in Rwanda in 2010, and today we are celebrating our 10 years of partnership with the government of Rwanda in the field of water, hygiene and sanitation services.
The whole country was going through the second phase of reforms, so the sector was still fragmented. One of the challenges was really to harmonize, to develop a program of work that brought together water, sun and hygiene under one roof.
WaterAid was a very key institution, a key organization in leading on the district-wide approach. We supported the government in doing a baseline, in doing some capacity assessment and an asset registry, and I believe that now it has been rolled out countrywide.
The different categories of users have benefited from services like the construction and rehabilitation of boreholes, rainwater harvesting systems, purifications of water systems, construction of hand-washing facilities, design and dissemination of behavioral change messages, and much more. WaterAid Rwanda interventions focuses on 3 pillars: providing resilient water, sanitation and hygiene services, improving the capacity of the local government and service providers to provide and manage wash services, strengthening collaboration and financing mechanisms to address wash needs in a sustainable manner.
Iyo tugiye hahandi hahurira abantu benshi twareba nk'ama centre de santé n'ibigo by'amashuri by'umwihariko twakoranye na WaterAid ikagenda idufasha mu kubaka ibikorwa remezo bifasha guteza imbere isuku n'isukura ku bana bari ku ishuri, ibigega by'amazi, amarobine yo gukaraba ndetse no kugeza amazi meza ku bigo by'amashuri. Ibyo ngibyo twagiye tubikorana.
Young girls face a number of obstacles that not only affect them socially but academically as well. One of the major ones being menstrual hygiene.
Twajyaga tugira ikibazo umwana w'umukobwa yajya mu mihango akabura uko aho yihererera cyangwa se naho yaryama kuko hari igihe hari bafite imihango ikomeye, ariko yadufashe tubona icyumba harimo aho ashobora kuryama n'aho ashobora gukorera isuku ye.
I'm very proud of what the Rwanda team has achieved. I'm also proud of the technical designs of sanitation in schools that have helped thousands of children in schools. I'm really looking forward to seeing an even more impressive progress in everyone in Rwanda getting access to wash.
In 2019, the government of Rwanda, through the Ministry of Health, launched a program called CBHPP, the Community-Based Environmental Health Promotional Program. The program aims at reducing the national diseases burden by empowering communities to identify their personal hygiene and environmental health-related problems, as well as how to solve them.
Muri iri tsinda ryacu twamagana umwanda rishingiye ku isuku n'isukura muri twebwe ndetse no mu bandi bari ku ruhande bagenzi bacu duturanye, twigisha iby'isuku n'isukura, twigisha gukaraba intoki, twigisha kubaka ubutanda bw'amasahane, twigisha gushaka ibimoteri byo gushyiramo imyanda no kubaka uturima tw'igikoni. Ariko ibyo twarebye dusanga bidahagije, dukora ikibina cyo kwizigama amafaranga yo kugira ngo isuku yacu irusheho kujya mu bikorwa.
Club 578 zabonye inkunga y'umushinga WaterAid ariko mbere yaho ntabwo byari bimeze neza kuko iyo nkunga itaragaragara, hari ibitaragendeka neza. Icyo umushinga rero wazanye ni uko wabashije guhuza ayo makarabe n'ibimina ndetse utanga inkunga y'amafaranga yashyizwe muri sako.
Noneho buri munyamuryango agafata kuri ayo mafaranga kugira ngo abashe kugera ku ntego yari afite. Wari ufite ubwiherero budakoze neza arabukora, ubutari busakaye burasakarwa, uwari ufite gukora mu nzu ahakora isuku.
WaterAid Rwanda, in collaboration with the government of Rwanda, puts efforts to improve hygiene and sanitation, fight against poor hygiene-related diseases and other preventable diseases at community level and in healthcare facilities.
Nk'abafatanyabikorwa b'akarere muri WASH twagendanye uru rugendo rukomeye, ndetse turacyari kumwe no muri uru rugendo. Nk'uko mubibona ibi bigega bimaze gusanwa mu gihe cya hafi aha. WaterAid yadufashije kubisana kuko ntago byari bigikora, byari bimaze imyaka myinshi bidakora. Uko mubona aya mazi aza hano ntago byonyine bihagije kuko turayapompa tukayazamura ruguru y'ibitaro. Hari ibigega binini, hari water filtration ikoresheje umucanga n'amabuye.
Serivisi ya maternité yabagaho nayo nta mazi ifite. Ubwo rero nk'umubyeyi uje kubyara bikaba ngombwa ko yitwaza nk'akavido ku ruhande. Kandi no murenge ku kwezi ubundi tugira abadamu bari 96 ku kwezi bagomba kuza kubyarira hano. Ubwo rero aho batwubakiye maternité bayagura muri bakwiye bamaze kubyara babona aho bajya.
Different toilet technologies are being adapted to fit the conditions of the communities, schools, as well as health centers, like the EcoSan latrine. An EcoSan latrine is a toilet system that makes use of human waste and turns it into something useful and valuable, in this case, fertilizers.
Iyi toilette ya EcoSan ikintu cya mbere yamariye cyamfashije cyanejeje, mfite ikibanza gito, yamfashije kubona ubwiherero ntazimura ngo njyana ahandi kuko ntabona aho mbujyana.
EcoSan does not pollute nor threatens the human health. EcoSan can be a sustainable sanitation solution for households in grouped settlements. It integrates sanitation and agriculture. This way, it can also help fight against malnutrition as one of its additional benefits. Dispatching water to all communities, including vulnerable households, is paramount. In Bugesera, one of the driest regions in Rwanda, numerous water supply technologies are being put in place to serve the communities, schools, and health centers. Among those technologies are solar pump, electric pipe systems, gravity-powered extensions, hand pump, and rainwater harvesting systems.
The WaterAid ni umufatanyabikorwa, umwe mu bafatanyabikorwa bakomeye dufite mu karere, dufatanya muri gahunda y'isuku n'isukura mu byiciro bitandukanye. Mpere wenda ku karere n'ibikorwa rusange, turafatanya no gukora igenamigambi no kureba investment plan cyangwa se aho n'abandi bafatanyabikorwa bakwinjirira.
The National Water Sanitation Corporation, WASAC, is a major WASH partner to both the district and WaterAid Rwanda.
Muri urwo rwego rero niyo mpamvu WaterAid izana ubwo bushobozi bwari bwarabuze, tugafatanya gushyira mu bikorwa iyo mishinga irimwo ibigo by'amashuri ndetse na community aho amazi atabashaga kugera bikaba byashyirwa mu bikorwa.
WaterAid twamenyanye muri 2010 duhuje intego, duhera ubwo rero dukorana mu kubaka ibikorwa remezo by'amazi n'isuku n'isukura, cyane cyane kubaka ibigega by'amazi mu mashuri, mu bigo nderabuzima n'ahandi hantu hahurira abantu benshi.
Hari isoko ituruka hagati y'iyo misozi, iyi rero niyo twafatanyije n'abafatanyabikorwa WaterAid turayikabuta.
The electric piped system built on this site uses an electric-powered water pump to extract spring water. This water is then kept in a tank after being cleaned. From the tank, water is dispatched to different water points, including a school and a health center.
Mbere tutarabona iri vomero twavomaga hariya mu kabande ahantu wagenda nk'iminota igera muri 30 kugira ngo uzashyikire amazi yaho. Bitewe n'amazi yahendaga agura ijerekani amafaranga 100, urumva ijerekani ni amafaranga 20, umuntu arushaho kumesa imyenda ye yose, arushaho kuhira amatungo amazi, arushaho gukarabya abana bakagira isuku kubera amazi ari hafi.
Muri iyi gahunda nari mbabwiyeho y'ibigo bidafite amazi, aho usanga wenda nta miyoboro ihegereye, badufasha kubona ibigega byitwa underground water tanks byubatse neza bifite metero kibe 90.
The ministry works with different partners, being the development partners, the NGOs, and among those includes WaterAid. So the ministry have been working with WaterAid. We worked very closely for all the past 10 years. We have implemented together several projects at policy level. One is we managed to pilot the district-wide approach.
Because of the enabling environment that WaterAid Rwanda is working in the country, one of the things that I also see is that the work that we do with government in terms of support, in terms of system strengthening and transfer of technical skills that we bring to the table is going to grow more and more because the environment is very, very conducive for such work to be done.
WaterAid invests in capacity building and system strengthening to support national and local government ways of working by building different capacities in service delivery, strategic planning, monitoring, financing equity and inclusion, and institutional arrangements.
I visited Rwanda 2 years ago. It was a wonderful trip. I witnessed high-quality work and high-quality partnership between WaterAid and government counterparts. And I saw the same at the national level. In a country which is inspirational in the progress that it has made over the last few decades.
Iyo umuntu arebye imiterere y'iki cyorezo n'uburyo cyandura, kugira isuku y'umubiri bifite uruhare rukomeye mu kukirinda.
The provision of safe water, sanitation, waste management, and hygienic conditions is the first line of defense for preventing infectious disease outbreaks, including coronavirus disease, COVID-19.
COVID bumwe mu buryo bwo kwirwanya harimo gusukura intoki. WaterAid rero turafatanya muri ibyo, ngira ngo mwabonye na za hand washing stations.
Abantu iyo binjiye mbere yo kutugana bakabanza bagakaraba intoki, tubona ari ibintu byiza cyane kuko bitugirira umumaro bikaba bitakwirakwiza coronavirus.
In order to respond to the COVID-19 pandemic, WaterAid Rwanda supported the district with sound systems, different media materials for behavioral change purposes, data collection tablets, sanitation equipments, and facilities like the construction of hand washing points to public places like markets, bus stations, and healthcare facilities, among others.
Water, sanitation and hygiene is really needed more than any time in the past because of the new threat caused by the coronavirus disease. So WaterAid is going to ensure that all what we do is COVID sensitive, but also we are going to heavily invest in supporting government's plan for response to coronavirus and national recovery plans.
Tuzakomezanya na WaterAid mu buryo burambye twuzuza iyo investment plan, ariko noneho no mu bikorwa n'ubundi dukenera mu karere cyangwa WaterAid isanzwe ikora, turifuza kurushaho gufatanya.
We are proud of all the people who have gained access to clean water, safe sanitation and good hygiene through the projects and advocacy and the capacity building interventions implemented by WaterAid since 2010.
Actually, to see the real impact, to the everyday experience and lives of the young people of Rwanda has just been phenomenal.
If the SDGs are going to be met on water and sanitation in Africa, it will start from Rwanda, and that is absolutely what we believe would happen.